Hey everyone, Donna Vincent here. In this broadcast today, I'll be talking about inflammation and an anti-inflammatory diet. Inflammation and an anti-inflammatory diet are becoming more of a focus when it comes to healthcare professionals because the anti-inflammatory diet is one of the best things you can do for yourself and your health. And helping people make that transition to a cleaner eating lifestyle is actually one of my focuses. I'm a certified nutrition coach. I'm also a home business owner, and I help people make that transition to a healthier, cleaner eating lifestyle, which is an anti-inflammatory diet. There's blood work that you can do to test for your inflammation, and that's called a C-reactive protein that you're testing. And it's a CRP test. Your C-reactive protein is found in your liver. So if there's inflammation in your body, this will be elevated. My husband recently had his tested and it came back low normal. For him, this was a big deal. He already has heart disease. He has a stent. He has a really stressful job. He doesn't get enough sleep, and he commutes 4 to 5 hours per day. So he has a lot of stress going on. He eats well because we've been clean eating for more than 20 years, but he still has a lot going on, and stress alone can cause a lot of inflammation in your body. There's two types of inflammation: acute inflammation and chronic inflammation. Now, acute inflammation is, for example, if you cut yourself. It's an immune response will send white blood cells to your cut so it heals itself, and that's temporary. The problem starts and disease starts when you're in a chronic state of inflammation, and your system is always at this state of alert. The most common chronic inflammation is actually leaky gut. Leaky gut affects more than 70% of people, and this is when your intestinal lining is damaged, so you're not absorbing the nutrients that you should from your food, and that's when other problems start. And when it comes to chronic inflammation, it can cause cancer, Alzheimer's, MS, arthritis, rheumatoid arthritis. There's a whole list of autoimmune diseases. I mean, there's hundreds of diseases and conditions that start with inflammation. So some symptoms of inflammation, and you don't have to have a disease to have inflammation in your body. Just know that inflammation is the start of many diseases. So if you have joint pain, stiffness, that's inflammation. Possibly could turn to arthritis. Frequent digestive problems, bloating, gas, diarrhea, constipation, eczema, skin problems, dermatitis, brain fog, depression, anxiety, allergy symptoms. These are some signs that there's inflammation going on in your body. So what can you do? And this is where we transition to switching you to an anti-inflammatory diet. You want foods that will nourish your body and heal your body. And some suggestions, these are just some suggestions: lean proteins, chicken, turkey, grass-fed beef, organic chicken and turkey. You don't want conventional meats because of the way that they are raised. Wild-caught fish. You don't want farm-raised fish. I've talked about the difference between farm-raised fish and wild-caught. You want wild-caught fish only. Fresh fruits and vegetables, nuts and seeds. Nuts such as almonds, walnuts, pecans, Brazil nuts, seeds, chia seeds, flax seed, hemp seed, sesame seeds, pumpkin seeds. When it comes to flax seeds, I get the whole seed and grind it myself so it's fresh, and I'm getting the most nutrition from it that I can. If you eat the whole flax seed, you really won't benefit because it'll just come out the other end. So you want to grind up your flaxseed or already buy it ground up. And I just use a small coffee grinder to grind my flax seeds. Whole grains that are gluten-free, because gluten is another food that is being found and being linked to inflammation in people's bodies, along with dairy, processed foods, sugar. So whole grains, you have millet, teff, quinoa, there's wild rice, brown rice, amaranth. These are all gluten-free. And then your good fats. You want to have a healthy balance between your proteins, your carbohydrates, and your fats. Olive oil, coconut oil, ghee, avocado oil. Avocados are great fats for you, as well as gives you fiber. So for an extra boost of anti-inflammatory assistance, you may also want to look into omega-3s, for example, because in the standard American diet, there's a huge imbalance between omega-3 and omega-6. Omega-6, because there's such a big imbalance between the 3s and the 6s, the omega-6 then becomes pro-inflammatory. So your body's, it's actually putting your body into more inflammation because there's too much omega-6 and not enough omega-3. Majority of people need to supplement omega-3 because you're not getting enough. Turmeric, I take that. My husband and I take all these that I'm suggesting. Turmeric, I also take with 4 other herbs. It's in 1 tablet. And the 5 ingredients together have an 18-fold increase in how powerful they are and how they can help your own body produce antioxidants that will get rid of the oxidative stress, therefore less inflammation. So some of these 5 ingredients alone are not nearly as powerful as they are in this one product. Probiotics, leaky gut. More than 70% of people are walking around with some form of leaky gut. So you need to heal your gut, and the diet, the clean eating diet changes that you make will help start to heal your gut, along with the probiotics to replace that healthy gut flora that you need. But you need to make sure that your probiotic has been tested so that it gets deep into the intestines where it needs to get to benefit you, and it's not killed by the stomach acid. So you need to make sure the probiotic has been tested to survive stomach acid. So those are 3 things that my husband and I take, along with our nutrition of clean eating, to stay with an anti-inflammatory diet to help reduce inflammation in our bodies. If you have any questions on any of the products that we're taking that I use and recommend, reach out to me. If you need help with transitioning to a clean eating lifestyle, reach out to me because I can help you with that also. Please share this with others if you found it beneficial. Donna Vincent here. I appreciate every single one of you for jumping on and watching. I will talk to you all again soon. Have a great rest of your day.